YouTube. So we're continuing our Wellness Wednesday series where we're talking about cancer screening. In our last Wellness Wednesday video, we talked about cancer screenings for cervical cancer and for breast cancer. Today, we're going to be talking about lung cancer, prostate cancer, and colon cancer screening. For colon cancer screening, there's a few different ways that you can do this. In the US, colon cancer screenings indicated to start for all persons who don't have some kind of family history or increased risk or symptoms of any kind for colon cancer at the age of 45. USPSTF has recently changed the guidelines to 45. There are a couple different ways that you can screen for colon cancer. The big one that everyone always loves to talk about is the colonoscopy. They take a camera to look inside the intestines, see if there's any polyps, bleed, abnormalities in your intestinal wall. If there are abnormalities, polyps, they will cut them off and send them for testing under a microscope. Put the cells of different slices of the polyps to make sure that there's none of it that looks like cancer-forming polyps. There's a lot of different types of polyps. Once these polyps come back as being normal, non-cancer finding, and that's great, you're in the clear, but they will use the number of polyps that are found, the type of polyps that are found, to determine how soon you need to come back for your next colonoscopy. There was no other real abnormalities found on your colonoscopy, then the recommendation is usually anywhere between 7 to 10 years for follow-up. But you can have some persons who need to have a colonoscopy every 3 years or every year. Illnesses that can increase your risk for colon cancer and that make it so that you need to get more frequent screening. And that's going to be something that is discussed on an individual basis. If you have not gotten your colonoscopy and you are 45 or older, go in and talk with your doctor about your risk. Other tests that they do for colon cancer screening, the FIT test or Cologuard, the sigmoidoscopy. There's lots of different ways that you can screen, but the way that you pick which one you want to use depends on your risk factors and your family history, whether or not you have any symptoms, or if you're taking medications that could alter the efficiency and outcome of this test. For instance, a FIT test or a Cologuard can come back as a false positive if you are someone who's taking a blood thinner or if you're eating certain food. Those tests require that you be screened a little bit more often than, say, a colonoscopy. For lung cancer screening, usually lung cancer screening is relegated to people who are 50 to 80 years old Lung cancer screening is usually for persons who are 50 to 80 years old and they have history of smoking. The smoking history, that tends to take a little bit of calculation. We're gonna ask you how many cigarettes you've smoked, how long you've smoked those cigarettes, if you quit, and when you quit, and if you have any symptoms. All of those things come into play when we're considering your lung cancer risk and whether you meet criteria for lung cancer screening. It is said that if you have been someone who smoked cigarettes before but you quit at least 15 or more years ago, then you're less likely to have lung cancer and probably don't meet the criteria for screening. However, everything is on an individual basis. So if you are a smoker, talk to your doctor about your need for lung cancer screening. For the USPSTF guidelines on prostate cancer screening, it's usually done in men 55 to 69 years old. There are a couple different ways that you can do a prostate cancer screening. Digital rectal test with the finger. I'll be honest, that test is user dependent. My finger versus another person's finger is all what we get and what we feel are going to be different. The other test is the prostate specific antigen blood test. So we're looking for enzymes that your prostate makes and secretes it into the blood. This is not a for sure test, okay, but it does help. Things we look at when looking at the prostate specific antigen test is the rate of rise of the PSA as well as how high the level is in regards to your age. Those three things all matter when we're looking at this number. Oftentimes, if the number is elevated, depending on your age range, we're going to look at the rate of rise. If we have a previous PSA to compare it to, we'll talk to you about symptoms, family history. So if you have a paternal family member who also had history of prostate cancer, that comes into play. Smoking history and a few other things that can affect prostate cancers. Routine screening for prostate cancer is not recommended for men over 70 years old. That is basically it. If you have any questions about cancer screenings, you can please drop them in the comments below. Every adult who's 35 and older, go and have your physical. Talk to your doctor about your cancer screening risks. I hope these videos were helpful. Drop any questions in the comment section below that you have for other health myths or health facts that you'd love to hear a little bit more about. Stay healthy, guys. Bye.
But look at you. Look how far you've come. You faced your trauma.